colleagues. So I'm pleased to introduce the third place award winners, and we have a tie for third place this year. And what that means is that you'll be receiving $25,000 in in-kind services. And so our first third place winner, if you can keep all that straight, is SaluTech. And their award is coming from Boston Scientific and M2D2. And again, just before I turn it over to you, just so you know, we're not there to shake hands and present you with the big oversized check this year, but we will be following up M2D2 over the next few days to provide the breakdown of the awards to each winner. So you'll be hearing from Mary Ann or Brennan or one of the members of the team in the next few days to hear more about exactly what it is that you'll be winning and how we can get those things to you. So SaluTech, you're on stage, and I am not the owner of the technology. So hopefully I will just stop talking and the company can start their presentation.
Hi, I'm going to share my screen now. Thank you so much. I'm so excited for this. So I'm a little speechless as the first winner, but thank you so much. I'm so excited to introduce my company, and I cannot wait to work with ecosystem en masse coming from Toronto, Ontario. I'm really looking forward to this opportunity. So I'll start my 4-minute presentation now, where I would like to introduce you guys to SaluTech, where we're creating novel conductive biomaterials for effectively treating atrial fibrillation. My name is Shui Lee, and I'm the co-founder and CEO of the company. What is atrial fibrillation? So here we have a healthy heart where all the electrical signals are moving as they should. However, in atrial fibrillation, there are all these erratic hotspots that cause the atria to beat very irregularly. As such, it's not able to synchronously push blood from the atria into the ventricles and into the rest of the body. And this is a serious and growing issue, with over 33 million people affected worldwide and growing rapidly with an aging population. Patients experience a decreased quality of life, ultimately leading to death through 5 times the risk of stroke and 3 times the risk of heart failure. And that's why here at SaluTech, we want to take a completely new approach to treating atrial fibrillation. So where we saw earlier, there's all these erratic hotspots. We have preclinical animal data to show that when we cover the atria using our technology, we're able to resynchronize that pathway such that the rest of the heart is able to work properly again. You see that in the bottom right corner with the atria covered in a rat model. So what is the magic of our technology? So it's the combination of novel conductive polymers, which are typically too rigid or incompatible with the human body, and marrying it with a bio-friendly biomaterial, creating a conductive biomaterial membrane that can be used within the body. And there's 3 very unique aspects about our technology. First, we have long-term studies to show that we can use it within the biological system. Second, we're able to manipulate the material so that it's evenly distributed for smooth electrical propagation. And third, and most unique to our technology, is our ability to manipulate the membrane so that it matches the speed of healthy heart tissue. So arrhythmia too fast or too slow, and you can actually cause more heart issues. And we proved this out in a long-term small animal study, where right after implanting our conductive biomaterial membrane, we see a drop in our atrial fibrillation. We've also set ourselves up with a strong foundation for future success, where we have 2 international patents, as well as more in the pipeline. We've been very fortunate to move this forward with non-dilutive research grants, and have also completed a pre-seed fundraising round. We've also had validation by the larger scientific community with 8 publications in peer-reviewed journals. So for us, we're completely focused on the regulatory process, and this includes planning to meet with the US FDA within the next few months. In tandem, we're also working on the commercialization aspects, including designing the delivery device, engaging key opinion leaders, as well as executing the reimbursement strategy. So this is really just the start of our technology. And what's so exciting about our conductive biomaterial technology is that it can be used for other key cardiovascular issues. And these are not just theories. There's at least some small animal data to show its safety and efficacy. We have a strong team leading the charge, as well as mentors from both industry and clinical to help us support us along the way. We also had the wonderful support of startup programs, including this pitch competition, to move us forward. For us, we are moving forward from a regulatory and reimbursement strategy, but we will move forward with a seed round to reach the end of first-in-human studies before moving forward with future clinical studies. And this is really what we're trying to do here at SaluTech, where there's a broken conduction system in the heart, and we would like to rewire it using our conductive biomaterial membrane. So thank you very much. And thank you again, M2D2, for this opportunity to participate in the competition and move forward. Thank you very much.